All right. Well, thank you all so much for joining us today for our recorded version of Coffee and Quality. We're really glad to be able to provide you this content, especially during this kind of changing time when everything's just, up in the air and it's just unprecedented. So we're really glad to bring you this content. So I'm Jessica Davison with United Way of Greater Houston, and I've got a great team with me here with Working Partner, and they'll introduce themselves here in a moment once we get to that slide into their presentation. So I just wanted to start out with kind of a reminder that Coffee and Quality has a Teams platform that's available for you guys virtually, where you can log in and kind of access resources that are available to the community. So there is, we are the pioneers of the Coffee and Quality teams. And so you guys maybe have Microsoft Teams already. And so you can just join into this. We have a post section where you can join the message board and ask questions. There's also, we try to post webinars that are available, different learning opportunities. We also have access to a lot of files that are available. So you can see different options that are there. We have literature and research. We have easy access to the Alice report, United Way tools, past Coffee and Quality sessions. So there's a lot there for you. And if you're interested in participating in Coffee and Quality teams, all you have to do is email me. It's open to everybody. So yeah, hope you can join us, and just shoot me an email and we'll add you to the team. So I'm really excited today to have Working Partner with us. What they're going to work through, their presentation is focused on using planning and checklists to simplify data management and collection. And I can't think of a better time than right now, what we're facing with COVID-19 and all that's going on in our landscape, about how to simplify some of our data processes. So I'm going to pivot to that team to let them introduce themselves. We have Jessica Pugil, Brett Sinclair, and Kemi. I'm going to pronounce your name wrong. So sorry, Kemi. Kemi with us today. So yeah, I'll hand it over to them.
Great. Thanks, Jessica, and welcome everybody. We hope you enjoy this podcast here, or webcast. I'm Jessica Pugil, and I am the lead at Working Partner, and very honored to be here today. I want to introduce my whole team, since we've got this fantastic group of people who know a lot about data, who will be joining me in the discussion about data today. So Brett, you want to introduce yourself?
Yeah, sure. I'm Brett Sinclair. I'm a data analyst with Working Partner.
And I'm Kemi Naji, and I am a research associate at Working Partner.
Great. And today what we want to do is talk about data, how to collect and manage your data in a way that will make it useful for you. When we talk to agencies, we as a team, as evaluators, love data, and often do a lot of work with data, and we work with agencies with data, and yet we find that agencies, for the most part, often. So as I said, often in the work that we do with nonprofits, many people have a lot of frustration and consternation about their data. I think people have a high appreciation for data and understand what it can do for them, but a frequent refrain is that the data that they're getting either isn't working for them, or they're being challenged to collect the data in a way that can make it useful to them. So, frequent problems that we hear a lot about is there's just so much data to collect, and there's different kinds of data to collect, what can be an issue. Everybody has had experience with trying to select a new data system, or move on to a new data system, or using tools to collect their data that isn't a database sort of a system. So that can be a huge decision and task to do, to move on to a database of some sort. A frequent concern is that data responsibilities are divided across the agency, and no one person has oversight over the agency. And so as a result, when somebody leaves or if somebody is out, it can be hard to either collect or report the data. A recent study actually by the Nonprofit Hub on data actually found that of the nonprofits, of the many nonprofits around the United States that they surveyed, 49% of nonprofits reported that they didn't actually know how their agency collected their data, right? So it can be pieced out into different places, and when that happens, no one has a big picture of the whole thing, and that can be a huge challenge for people. And then finally, as Jessica Davidson talked about at the beginning, you know, unfortunately in Houston, we have more experiences with disaster than we want, and how to collect data and what to collect in times of disaster can be a real challenge. You know, already we're in challenging times during a disaster, and so then what do you do to collect and move forward so that it's informative for you? So those are the overall challenges that we have. So as you know, data advocates, we often tell people, look, having good data is key to telling the story of your success. We know so many organizations are doing really, really great work, and it can be frustrating for us and for them when their data doesn't actually show all the great work that we're doing. So what we wanted to do today was to kind of give some ideas and guidelines and steps on how you can take more control of your data and be able to more seamlessly manage your data, track your progress, and run your organization in various ways so that you have programs that are on target for meeting your client needs, and you're doing them as efficiently as you can with the resources that you have. So that's what we're going to do today. So Jessica, right? So it doesn't always good to do right now in a time of a disaster right now, but when you can, the key to getting control of your data is to create a clear and specific data collection and management plan. These are not talked about a lot. There is some good guidance out there about how to do it, but we're not familiar with many organizations that do it. But when organizations do it, we can see how effective it is for them in having control over their data. And a data collection and management plan has really 4 simple steps. Decide what data you want to collect, identify and train people who will collect the data and when they will collect that data, determine how you will collect, the methods that you will use, the tools that you will use to collect your data, and then collect, compile, and analyze your data for findings. And so what I'm going to do next is just to go over how these steps and what are the steps to be able to get a clear plan into place. So the first thing that you want to do is decide what data you want to collect. Now, no one is in a situation, very few of us are in a situation to decide those decisions, that make those decisions and by scratch, right? Most of us are collecting a huge amount of data. And actually that's one of the big challenges that nonprofits have, is like they've collecting a ton of data. Either they've been collecting old data, data that people told them to collect under a grant from before. So it can be lots of reasons why they have a lot of data, and it can be overwhelming for people. So if that's your situation, so the first thing that you want to do is just look at the data, and if you are not using any of those data elements, stop collecting it. We all love, I think, data. Everybody wants to know more. And sometimes what happens is we get kind of greedy and we add a lot of data items and we start to collect data items, and that collection becomes overwhelming. And then we have all this data then that you don't use. So really what you want to do is look critically at the data that you are collecting and decide if you're not using something, then by all means stop using it. Really kind of 4 things to think about what you need to help you decide what is the data that's most useful to you. So if you're starting by scratch, or if you're trying to get a handle on all the data that you currently collect, there's 4 things that you want to think about. So the first is data that helps you learn what is working or not so that you can improve your programming. So that can be things like understanding how many clients are using a specific service. We offer a lot of services, but sometimes we don't look at the utility of that service. So that can be something that you're doing. You might want to look at, what kind of, how frequently a client is, if you have a number of services, how many of those services clients are using. If you have a bundled approach to your services, you'll want to know how many of your clients are actually using all of the services that you bundle. Those are all things that will help you to really get a good understanding about, is the program working as you anticipate it to work? And if you have a logic model, sometimes a logic model can help you think about what are the things that you expect that people will do and what is the data elements that you need to track that. So that's the first thing, data that helps you learn about is your program working or not. The second one is data that helps you track your client needs and service use to adapt your program as needed. So it's really important to understand what your client needs are, right? We're all nonprofits, but the bottom line for any kind of business is you provide the services that client needs. So you always want to kind of be able to make sure that you're collecting data about what your clients need. Maybe sometimes that's just your client demographics to understand if yours, for example, a job training program, what is the educational backgrounds of your clients to know that what type of other additional supports, the educational supports they might need in their job training program to be successful. Or if you are a financial coach, to understand, what kind of savings does a client have or what their credit score is in order to help you to better meet their needs. So it's important to collect data about the client so that that's relevant to your program so that you know that your programs are on target. But another way to look at this particular issue, data about client needs, is to think about from the client perspective, how often do you share your clients' success data with them to help them understand, are they reaching their goals? So sometimes you want to look at data not just from what you need and what's useful to you, but also from the viewpoint of understanding what would your clients want to know, are they reaching their goals? So it's important to take that lens as well when you're looking at your data. A third point to look at your data is data that can be used to communicate your impact. And this is the thing that a lot of nonprofits are often very focused on, is what are the things that a funder needs to know, or how do you know that you're having the impact that you hope to have? And so it's important, and again, I'm going to circle back to your logic model. If you have your logic model and you have an idea about what the outcomes that you want to make sure that you have metrics that will help, that are aligned to those outcomes that you're expecting, so that you can be able to tell the story of your impact. And then finally, I think a lot of people are already doing this, is data that's needed to meet your grant reporting requirements. And this can be a lot of a challenge. A lot of times funders and other people want you to track data that maybe isn't core to what you normally track. And so it's important to be responsive to what your funder needs, but at the same time, if there's someone's asking you something that is not useful to the work that you are doing, you might want to do a little pushback and ask what the utility of that data element might be. Because at the end of the day, it's all about the data that you're collecting is about what you're going to use, which is why if you're collecting a bunch of data, the first thing you want to do is look at what you're collecting. What are you using? If you're not using it, throw it out. And then what are the other data elements that you need to make sure that your program is on track, that you're meeting your client needs, and that you're able to measure your impact. So those are the 4 kinds of data. I'm going to actually, Jessica, if you can go back, and I'm going to ask maybe Brett and Kemi, I'm going to put them on the spot here. Do you guys have any other comments about the right kind of data to collect? Anything that you want to say on that to jump in?
I think when we're talking about the right kind of data, I think you hit the nail on the head when you talked about it's data that's useful for your organization, So if you're collecting I know we've worked with a few clients that are collecting bundles and bundles and heaps of data, and a lot of it really is just to meet the requirements of their grantors. So if that's the case, maybe talking with your grantor about what's really necessary would be a good conversation to have. In other instances, it may not be so. It may not bear fruit. It may not really help get that down. But when you're talking about the burden of data collection, that's really a lot of what happens in this arena, especially when you're talking about disasters. You want to decrease that burden as much as possible. So any way you can think about doing that would be beneficial.
Great.
I agree. And I think that the right kind of data also depends on the client that you serve. So, you know, some people serve clients that they may not be able to get a certain data from, and, you know, being able to adapt to that as well, I think is important.
Yeah, great. It's really important to understand your clients and what their needs are. So if there's any data that you must collect, it really should be around your clients, their demographics and their needs, so that you can be responsive to meeting their needs. Okay, so we're going to talk next about in times of disaster. As Brett said, you know, at the end of the day, when you're in a disaster, most of the services that are being provided are relief services. So you're not really trying to collect data that will ultimately yield any outcomes, because the work is really about relief. So what you really want to do in times of disaster is focus on the basics. And frankly, when you talk to funders who are funding disasters, they're really interested in just a couple core pieces of information. They want to have information about the people or households that are served. And again, some of those key demographics, their race and ethnicity, their age in terms, are they youth, adults, or seniors? Zip code, geography is really important. People are often interested in understanding sort of the communities that are best served in times of crisis. And then maybe some vulnerable population statuses. Are they homeless, or are they uninsured, or something like that? So just a few key demographics. You don't have to collect it in a time of disaster. It's probably not necessary to know their education levels, right? So you don't have to collect everything on the demographics, but these core ones typically are the things that are important for understanding the reach of relief and who's actually offered the services. And then the other piece that's really important is, what are the services that you provide and how many people actually received those services? So sometimes an agency will provide one service. If you're a food or meal service, you know, all you're doing is offering food baskets or meals. But what we've seen in the past is a lot of agencies offer a wide variety of services. And so it can be really helpful to know how many clients were served in each one of those particular services. And that's not just good for you to be able to report what services that people did, but it helps us to really learn what are the services that people are looking for or most beneficial for people in times of crisis. So we've really only recently kind of decided that we really need to pay attention to what happened, what the needs are of clients during times of crisis. And so collecting this information can help us ultimately get better at being responsive in times of crisis to understanding what are the needs of clients and when are the needs. Brett did an interesting analysis of Harvey data, and we found at the beginning people just needed short-term housing, but 6 months after, the services that they needed really shifted. So, and it was a different type of a service that they need. So we want to learn about what are the services that people need in times of crisis. So collecting those two pieces of information, people who are served and the services that they get, are really the core things that we have found as useful during times of disaster. So once you've decided on the data that you're going to collect, you want to identify and train your staff who will collect and report the data. And this is an instance where we've heard a lot of people who are agencies that have the data siloed. There's the frontline people who are collecting the data, and then there's probably somebody in the administrative offices who manage the database, who can pull the data. But what happens a lot of times is no one has an overview of what of the data is. And so that's not really good. At the end of the day, you really want to be able to have everybody understand how the data that's collected at the front lines is used at the end for analyzing and reporting the data. So once you identify who needs to collect the data and who's going to report the data, it's great to do cross-training of staff. So when you're doing data collection, don't just have your frontline staff who are closest to the data collection. Make sure that more people across the agency are collecting staff. For data reporting, a lot of times that's a very technical process, and so not everybody is going to need to know how to pull the data and analyze the data, but it's certainly helpful to have at least more than one person know how to do that, but everybody to have a general idea about how the data is used and reported, because sometimes if you can understand better how the data is collected, when you're analyzing the data, you'll analyze it more appropriately. So having a bigger picture on both how the data is collected, reported, and analyzed is important to tell the accurate story of the data, but it's also important to make sure that many people within the organization have experience with collecting, reporting, and pulling down that data from the data system, so that if somebody leaves abruptly, or it goes on short-term leave or something like that, that you have somebody who can fill in to be able to provide those services. So cross-training staff is really key to sustainability. And then you want to determine how you're going to collect the data. So once you've identified people and you've trained them, you want to look at the methods that you're going to use for collecting the data. What we have found over time is that when people are using a database, the practice of collecting and entering data into the database is more integrated into the daily workflows, which is really key. A lot of times in some of the work that we do with Thrive, we have agencies that collect the data on an Excel spreadsheet, and that Excel spreadsheet is very effective at collecting all the data that it is, but it's less integrated into the work. And so what we find is agencies then are like, oh my goodness, I haven't collected that data in a long time. And so then they got to scramble and they have to take a lot of time, find time to be able to collect the data and report that data. So generally databases create an opportunity for you to integrate the work of data collection into the day-to-day workflow. And so as a result, your data quality is a lot better. So we all spend a lot of time with databases, and databases are really good, but a good practice is maybe not to be dependent on just one database for collecting all of your data. So there's within an organization overall, of course, you're going to want to collect your client and program information, but you're going to want to collect data about funders, and you're going to have some information about your finances. And sometimes there's an instinct to kind of roll all of that into one database, but it can be very clunky for the database. Reporting can be clunky. It might be better to break those out into different kinds of reporting systems. But the other thing is we all focus a lot on sort of quantitative data, but as we've gone over the years, we're really learning how important stories are. Stories are important to understanding client impact, but understanding how clients experience your program or the process of your program. It can be helpful for understanding how to make your programs work. So you're going to want a way to be able to also collect client stories on a regular basis. So you'll want to think about how you're going to do that. So there's different tools that you can use. There's databases, there's Excel, simple Excels, there's tablets that you can use to create access data files, forms on which to collect data simply. There's actually a lot more tools at your disposal to collect the data more simply. So you just might want to think about having different systems for reporting the data. One of the things, anybody who in Thrive kind of knows, I've talked a lot about it. I'm going to put this up here. This is a book that I'm a huge fan of. It's called The Checklist Manifesto. And this is a fascinating book. It's a super easy read, and has a guide on how to make checklists. Bottom line is checklists have been proven to be incredibly effective at helping you to make sure that all of the steps of a certain process are followed and followed well, which in the end results in better outcomes. So certain industries use checklists on a regular basis. So for example, every time you get into an airplane, right, before you take off, those pilots that run that airplane have to run through a checklist to make sure that every step has been carefully taken, because if they accidentally miss a step, it could result in the death of a lot of people. So airline industry, the construction industry, and increasingly in healthcare, when a simple mistake, a simple error, missing a step can have huge, devastating outcomes. So checklists are increasingly being used in those arenas, and they're proving to be really effective to make sure that every step is taken and you get a better outcome. And this book was created to be able to create a checklist in healthcare so that we can improve health outcomes across the world. But what it's in our work and in the work that we do for nonprofits, having a checklist can make sure that your data quality is good so that somebody doesn't miss a step in entering data into the database or into whatever tool that you select. But also, checklists have just been magical for helping organizations get through staff turnovers. You know, a lot of times we hear a situation that one critical person has been collecting the data, and when they leave, the agency sees a huge decline in their data collection until somebody can be hired again and spooled up on trying to get it. And being able to enter that data. One health clinic that we worked with had people entering the data that their person, a bunch of people kind of left at one time and they didn't have any data collection for a while, and they lost hundreds of thousands of dollars. For them, not entering that data was about earned revenue, and they lost money, and it was a terrible problem. So we all know that there's these big hiccups when you lose staff, and a checklist can be a really great tool to making sure that if you lose somebody, that if somebody comes in, that they've got this checklist and they've got the key steps that they have to take to go through it, and it helps you to maintain and sustain your data entry until you can do further training, until you get more people expert on entering that data. So checklists are really great, not just for making sure that your data quality is maintained and making sure that it's as complete as it needs to be, but it's a fantastic tool for helping you get through times when you have some staff turnover. And then just to go back to the point that we said before, cross-training on staff. So if staff has all been cross-trained, even that person who isn't entering the data on a day-to-day basis but knows the general outline can pick up a checklist and be able to run through that checklist pretty quickly and enter the data so that your data collection stays pretty constant through times of staff turnover. So I highly recommend it. Checklist Manifesto. It's easy. You can get on to Amazon and get it, and it's a quick and really interesting read. So that's checklists. And then again, in times of disaster, you want to keep it simple. So a lot of times in Houston, we're used to flooding, and in times of flooding, you may not be able to get to the office to enter the data into your database, or staff are not available to enter the data. So it's all about, again, in times of disaster, is keeping it simple. And again, because really what you're probably doing is offering relief services. There's just some very simple tools that you can use to collect data. Simply paper logs of people who came in, writing in their names, collecting a little bit of basic demographic information, and then checking off the services that person received. Tablets, tablets are super easy ways to collect basic information, put it on a form. Increasingly, we find that people are very used to entering basic data into a tablet with some information about it. It can be automated in that regard. Those can help you collect the data simply during these times of disaster. Maybe you don't want to put that data into your database. Maybe you just want to aggregate the data and report it to your funders. So you may not have to put it into your database, but if you do have to, that you've got the records and the data that you need later on to put it into your database. But again, this is why it's useful to have different ways of collecting your data over time, so that you're not totally dependent on that database for collecting your data, but you can have maybe a paper tool or tablets or something that can take up the slack in times of disaster, that will just collect the basics in a difficult time. So you've decided the data that you're going to collect, and you've trained everybody. Maybe you have some checklists to make sure that they're entering that data thoroughly. You've developed tools in your database for collecting the system. So now all you got to do is compile the data, analyze that data. So here's some great tips for making sure that you are using, once you've collected the data, you're using it. So the first is setting schedules and timeframes for collecting and reporting the data, and integrate that into the client workflow. Jessica Davidson and I were just having a really interesting conversation about that. Is a lot of times for some reason, we just don't think of collecting and reporting data as part of our day-to-day work. And yet it really has to be built into your daily work, because at the end of the day, this is a critical piece of information that you're going to need to help shape your programs. So you really want to make sure that you've set time within your day-to-day schedule or your weekly schedule for collecting and reporting the data. It's super important to making sure that your data is going to be ready when it's time to pull it and analyze it or report it to your funders. We want to make sure that your CQI process is using your data. So make sure that you've got an opportunity within your CQI process to check on how your data collection process is going. Is it going the way that you anticipated? Do you need to make some changes to those checklists to make sure that it's moving slowly? So, you know, in your regular CQI work, you want to make sure that the CQI has a time to look at your data collection and reporting processes and checking against the reality about how it's working, and make sure to constantly be improving that. As Kemi said before, you can always be adjusting and improving your processes so that your data quality gets better. And then one of the tricks that we like a lot is data parties. And Jessica, I don't know, this is a link. If you want to click on that link, this is a simple, I wonder if it'll come up on your screen. And hopefully that people will see it, but it's data parties. If this doesn't come up, you can Google data parties. They're very common in evaluation worlds, but they're just fun ways of going through, looking at the data. Maybe I have myself sponsored data parties. We've bought pizza and Coke for people, give people time to get together to enter their data into the database, talk about problems they're having with data collection, and kind of make sure that process. So this is just the Journal of Extension just talks about what a data party is and how to do a data party, cool tips and tricks for doing data parties. So it's a very helpful tool for people who want to do data parties. The other way to do a data party is after you've collected the data, and the person who's reporting it and getting ready to analyze it can pull that data and bring that data together with all the staff, the frontline staff, and everybody to look at the trends and say, what do these trends mean? Too often, we have the analysis of the data being done by somebody who isn't on the day-to-day front lines and doesn't always understand sort of what some of those data elements mean or some of the trends. So having frontline staff join the person who's analyzing the data to look at it and help to understand the trends is great for doing a better and clearer analysis of your data, but also is good for the whole organization to really understand, again, to go back to look at what is the data that they're collecting and how they're collecting it, and to fix any bugs that might be there in terms of your data collection process. But ultimately, those kind of data processes are really helpful in making sure that your analysis of the data is spot on and really helpful to informing your programs. So data parties are really great, and I encourage you to learn more about them.
Yeah, I really love this resource. These are some of my favorite questions to pose to people when they're talking about their data after they see their reports or their results. Like, what surprised you about the data? You know, what's missing? What are some other meanings? I think the more you can have these conversations about the data, the more you take it away from the data system and put it back into the program to really help kind of understand like where you are. And I think that's even relevant right now in this moment, you know, as you're like churning and burning through different things, you know, like taking a moment to be like, hey, what are we seeing? What are we not seeing? And you can really use this as a way to pivot what you're working on as a response to what's going on in the landscape right now with COVID. So I think this is a great resource.
Yeah, data parties are really great. And actually, Jessica, what you said there, I think really kind of resonated for me. A lot of times people who are collecting the data, it really just starts to feel like a grind. And so sometimes they don't really understand, I'm putting all this data in and they don't really know what's happening with it. What does it mean? And giving the people who are collecting the data an opportunity to look at the data and be a part of that analysis, it makes the data collection more relevant to their day-to-day lives and why it's important to collect that data and what it does to show the effectiveness of the work that they're doing. So many of our people, they're working so hard, but they don't always have a chance to look at the data that's collected and to see how that delay data shines a light on the effectiveness of their work that they're doing. So, you know, divorcing the data collection process from the analysis piece can really kind of turn it into a horrible experience. Whereas if you can keep putting all of those pieces together, people understand why we're collecting the data. They can see how the data comes to life and tells the whole story, and then also becomes a fantastic tool for understanding if your programs are working the way you expected them to work. So I think
and I just wanted. Yeah. I was gonna say, I love the idea of the data party as well, and it could be a good time to even, you know, find out what challenges people are having, or, you know, do some more CQI around that, and, you know, best practices and what's working and what's not. So
absolutely,
yeah, I think it's great.
Right, a data party can be a tool of CQI on using their data, right? So that could be a CQI practice. So, you know, at the end of the day, you know, data can be an asset, and I think most people recognize it, but the trick is to make sure that you have control over the data so that it's being gathered properly, you're reviewing it frequently, not just one person, but other people who are collecting it, so that you can make informed decisions about, is the program working? Are we collecting the right kind of data? Is this telling the story of our impact? So the moral of the story is, have the data work for you. And the best way to have the data work for you is to create a plan and then put the infrastructure into place to collect it and report it and analyze it in a way that it works for you.
Well, yeah, thank you, Jessica. That brought, like, a lot resonated with me throughout your presentation. So I'm really glad that we're able to, you know, really have this discussion right now, but then also share it, you know, outward with the community. So I'm glad that, you know, we'll have this here and it's recorded. So I guess that's the benefit of this. You know, if it had been typical Coffee and Quality, you'd have came in on Thursday morning, shared it with everybody, you know, we'd have had the PowerPoint to share out afterwards. But now we have a recording of this, so we can always, you know, use it as a tool to refer back to. So, you know, as we were shifting from the in-person session to the virtual session, you know, we posed to our common Coffee and Quality participants, you know, what are some questions that they have about data? And so, you know, they presented some questions to us. So I kind of wanted to use this time to kick the questions around with you guys. So our first question right here is, how can we capture our survey data virtually that's secure? Right, that's $1 million question right there. I know there's a lot of options out there. So, you know, I think I'll start with Brett and kind of find out, what are your thoughts on what they can do?
Right. So as far as capturing your data virtually, there's a lot of programs out there that we have experience with. I mean, you have SurveyMonkey, you have Qualtrics and things of that nature. There's other simple ones. You can use Google Forms and things like that. The question is really security. So what level of security do you need for the data you're collecting? Are you collecting super HIPAA, you know, PHI data that is protected by HIPAA? If that's that kind of thing, you're going to need probably a second layer of protection there. So it's not as simple as doing something on an online service. You'd also have protections on your computer, which you'd probably have to work with IT to set up on your end as far as your organization is concerned, and the HIPAA compliance around those things. But capturing the data virtually shouldn't be much of an issue if you have access to those type of programs. There's a lot of free ones. So like I said, Google Forms is a free one. And then there's others out there as well that you can find for capturing data either over the phone or online, whatever it might be.
Yeah, you're right. There's a lot of resources out there right now for this. I know there's also JotForm that has some HIPAA compliance as well, kind of recently added into it. And then I know also Google Forms, people are using that, if they don't have as much PHI that needs to be that secure, like there's a lot of different options out there. I think one of the things you really need to take into consideration is your budget. How much do you have to spend on this? Do you not have anything? Do you have to go with kind of free resources and, make it as secure as you possibly can? Also too, there are a lot of resources out there, a lot of options, and some of them are more user friendly than others. So what's your startup time, right? Are you trying to get this out to clients next week? Or do you have, like, you're trying to do it tomorrow? What's your time to learn the software so that way you're using it to the best of your abilities? I know we've been using Zoom now, just as a small example, Zoom for a couple of different sessions. I feel like each time I'm still trying to learn something new on it. Hopefully by next week we'll be a little bit, every time we'll just master it a little bit more and more. But, if you're paying for a software system to survey client data, you really want to make sure you're getting the most bang for your buck.
That's right. Yep.
So Jessica, I'd like to jump in if that's okay on this one.
Please.
I see this as two questions, right? How can we capture our survey data virtually? ? And that's a question. And as you guys talked through, there's a lot of great platforms out there. There's online. I do want to raise to people it's increasingly hard sometimes to do different phone surveys. A lot of people won't answer their phone, and it can be hard to do online, emails and stuff like that. So texting is increasingly people do tend to respond to surveys via text. So I want to encourage people to investigate those platforms a little bit more. So I think there's lots of softwares out there about how to do that. The question about security is another question, and I see it in two ways. One of them is what you're talking about is there a platform out there that is, HIPAA compliant or something that allows you to make sure that, that the data is collected is done securely online. But there's kind of a low-tech way to make sure that your data is secure, and that is not to ask some personally identifying information. And so, and again, it kind of goes back to a lot of times we all want so much information. We just want it all because we just love information and we want to understand it. But if at the end of the day, if you're going to do a survey, if you don't really need to know that person's name, and if you don't really need to know some personally identifying, take it out. And then it doesn't matter the platform that you're using because the data can be is less personally identifiable. So I think that there's a couple ways that you can approach it. That's a high-tech and a low-tech way, and I think there's a lot of strategies around low-tech that can get you the information that you need without asking some of that personally identifiable information that can still be useful to you.
Yeah, great, thanks. So for the next question, I wanted to start with Kemi. So Kemi, the question posed from our participant was, how do we prioritize what needs to be recorded and what can be skipped?
Yeah, I think that depends on, the agency is by agency by agency, depending on what your program needs are and what is meaningful for you. And I do want to reiterate what Jessica said earlier about, looking at the data that you're collecting, and if you're not using it, then it could very likely be skipped. And then especially in times of disaster, prioritizing those basic demographics, those easy, answers that, people are likely to give. So,
Yeah. So on that same kind of frame of thought around like, what can we skip, prioritizing what our needs are, we also know that sometimes staffing can be a challenge during this time. So for the third question, Kemi, how do we train admin staff to complete data entry in such a short period of time?
Yeah, I think also, we kind of touched on this a bit in terms of being able to work it in your everyday processes, and being able to, not let it be something that you do at one time where it's cumbersome and, you have to, do all your data entry at once. So I think just piecing it out and including it in the process, I think would really help.
Yeah, that's definitely,
Yeah, that's part of it. I want to add on to that too. I mean, so it says in such a short period of time. Hopefully, in an ideal world, there isn't much need for training in a crisis situation. Hopefully, the training's occurred over time. The cross training has already happened in the agency. And so you have multiple people that have capability to do this type of data collection and information. And then if there is some sort of training that needs to happen, that checklist, the stuff that Jessica was talking about around checklists and things like that, are a great way to orient people and have them understand kind of what needs to be collected and make sure they're not missing important pieces.
Yeah. And I think right now is an opportune time to create those checklists, right? Like if you are having to face with having to train a new staff member on this, that's, writing out that checklist, creating that this is how you do this is where you go to do that. And think of the full spread, not assuming that, oh, they should know where that Excel file is or which person has what information. It's, if you can really take a moment to write out your whole process right now, that'll help you if you have the short-term period and you have to train someone very quickly. Right. So for our next question, Brett, I'm going to start with you again on this one, but what are best practices to give admin staff access to client data?
As far as access to the data, sometimes agencies have a lot of difficulty accessing their own data. Sometimes they're in certain platforms that make it hard to get out. And so really it's training around that. Sometimes it's training with the IT staff, it's training with other people that are kind of experts with the database, but that's also part of that cross-training piece. The other thing is if you're having these regular meetings, CQI meetings and those data parties and things of that nature, hopefully the data is getting shared with all, so people are getting exposed to it in different settings and understanding the data, understanding what they're looking at and kind of how the program's going and that type of thing is really important. So I think those type of things are ways that people can get to it.
Yeah. Jessica, do you have any thoughts about what are some best practices for training folks to have access to client data?
Yeah, I'll just echo what Brett said. I think data parties are really a fantastic way to give them, because a lot of times the admin staff needs to be able to see the data with other people so that they can kind of understand it and understand how the data was collected and some of that other stuff. So I'd kind of want to know a little bit more about what this question is give admin staff access to be able to enter the client data. So I'm not entirely sure what the source of data is. I do also want to say right here that it's important that agencies, the practices, some agencies, there is that personal information that needs to be DV, domestic violence agencies have to really protect that access, privacy to data, so only certain people can access it. I think that's true in healthcare and some other types of services. So I think each agency, of course, and usually those agencies are very clear about who can access it, but there should be policies around it to make sure that who can see it and how they can see it, so that you can honor the privacy requirements that certain industries require. So and then cross-training. Everybody needs to understand. Again, it's what is the whole picture of the data in your office? How is it collected? What is the tool that it's collected in? How is it reported? And then when do we analyze it? So I think the best practice is that admin staff understands how data is collected and reported with the agency, and then data parties and things like that will help them to look at it with an educated eye.
Yeah, and I'm really glad you mentioned about what's your agency's policy, because I think that's something that you can look back to about what are the access privileges that need to be given to folks so they know what and how much data can be shared or can be accessed to for staff that are just doing, like, is your staff just doing basic demographic information? If that's so, then they don't need the whole mental health client note, right? So just trying to think of it like that. And if your agency doesn't have policies around that, then now's a good time to kind of, explore that at this moment. So.
And this question also, what you're saying also relates to that first question too. There should be policies about data if you send client data. A lot of times we have agencies send client data to us, and there's a lot of information in there that, and they still have kept the client's name and address in their things. Everybody should be informed about how to ensure that the client data is always kept private. even if it's not highly, highly personal kind of information, a financial coach that sends some financial data with a client's person. Do you really want somebody to know their full finances?
Mm-hmm.
So, these are things that we all need to be mindful of in this modern day when you send stuff online, who can actually access it even inadvertently. So I think there's a lot of mindfulness about privacy in that particular question.
Right. Thank you. So I've been a very good listener of this session and really have, just really soaked up a lot of the information. So I think I know the answer that you guys are going to say for this next question, but I'm going to pose it. So how do we rotate data entry duties as staff fall ill and new staff join the team?
Checklists.
Cross-training.
Yeah.
Cross-training.
Cross-training.
Cross-train checklist.
Yeah.
Yep. We need t-shirts that say cross-train and checklist.
Exactly. And data parties.
And data parties, yeah.
And data parties.
Yeah, well, good. Yeah, hopefully that is just something that, we're really driving home that point, so that way people can really take that back in, and how do we use that now in this current space to help us get through this time. So my last question I'm going to pose to Brett. How do we reflect on the impact that COVID-19 is having on numbers and outcomes in a frank way?
So COVID-19 is kind of interesting. So everybody's all working remotely now. So people have access to their ongoing clients, but what you're going to see a drop in most likely is new clients. And so it's just something that you got to be honest about. And as far as outcomes, I mean, during this time, it's really hard to get outcomes just because, I mean, you're not in contact with people as often, it's a little more difficult to see things happen. And when we're talking about this kind of disaster situation, any kind of disaster situation, really, you're in a state of relief. So people are providing relief for individuals. With COVID, it's a little bit different because some people have little respites as far as like subsidies or deferments of payments, or people being lenient on apartment payments, mortgage payments, things like that. But in the near future, those things are going to run out, and then people are going to be in that kind of desperation mode, and then we're going to go into relief mode. And when that happens, it's really all about outputs. It's not so much about outcomes. It's about collecting that information, that simple information on the number of people being served, what service they're being served in, and those simple demographics, so that you can serve as many people as possible, but still collect the information that you need for your programs.
Yeah. No, that's.
Yeah, I think the key thing about, in collecting data in any disaster is keep it simple and focus on the basics. There's already so much going on. And it would probably compromise the quality of the data if you were trying to collect everything anyway. So, better data collection on a smaller set of data is going to be far better than, a bunch of data that isn't maybe reflective of everybody, or maybe not entered completely or something like that. So keep it simple.
Yeah, no, thanks. So I would love to kind of, as we wrap up, kind of get your, what's your reflection that you're having right now, as we've had this, nice time to just sit here and talk about data, and really, for us, for data enthusiasts, this is really enjoyable. I had a great time with this. So I'd love to hear kind of what's your reflection or your food for thought that you would have as your final words with the participants that are viewing this webinar. And I'll start with Kemi.
Yeah, I think I want to say, especially during these very unusual times, I think it's important to just keep up to date on what's going on and keep doing learnings, to watch webinars like these, and, do more research around what people in the field are doing, and just leaning on each other, trying to be as innovative as possible and bounce ideas off of your colleagues. And just, I also want to reiterate what Jessica said, about keeping it simple and just collecting the basics, because we know that there are some populations that may not be as forthcoming for wanting to, give their data out, and being mindful of that, which, we know that sometimes they're the ones that need it the most. So just, keeping it simple and, doing more learnings around best practices and what people are doing during these times.
Yeah, thanks. Brett, what are your final words?
So what I would say is my reflection on this is really just plan. You know, it's like you got to have a data plan in place. You got to have this stuff in place before a disaster hits. So have the cross training going on, you know, the data parties going on so people understand the data before something drastic happens. And then once something drastic happens, you have those things in place. And also contingency plans, things like the checklist and people in case something falls through or something drastic happens during those times of disaster. So it's planning up front and then keeping things simple, as Kemi said, on the back end. Once something happens, you know, collect what you can, what you need, and then serve as many people as possible while collecting that information, and should be good to go.
Yeah. Thanks. Jessica Pugil?
So my comments were obviously all birds of a feather. So I think bottom line is for me is get steps into place so that you can control your data rather than your data controlling you. So often I hear from people that they don't feel like they have any control over their data, or they feel kind of pulled out of shape out of the data that they have. And, you know, try to get control of your data and it will be good to you. If you organize your data, it'll work for you.
Yeah. Thanks. You know, I think my final words, I'll be a little different. Even though I do plan on, we need t-shirts or coffee mugs that say, keep it simple, checklist, data parties, cross-train. These things will be coming. Just wait, we're gonna have coffee and quality swag. But in all reality, you know, I think right now my reflection is to really listen to your frontline staff, listen to the folks that are delivering service, you know, and be open to pivoting as needed for your data needs. It might not be realistic to get some of the information right now. You know, keep it simple, collect the bare basics, so that way you can have that information to help you as you move forward. And then I really just give yourself grace with that. Like, it's okay, but document when you made that change, when you stopped collecting a certain pre and post test, when you stopped doing something, so that way, you know, as you're having this data party and having this discussion about your data results, you can go back and say, oh, the week of March 9th, we stopped collecting that. So that's maybe why why that dropped off. You know, it's always best to be able to pin it back to something. So create an Excel, put a document up there to where you can just keep track of what you're changing with your data needs. So yeah.
Good reflection.
Great.
Good reflection, yeah. So, you know, we're really glad to be able to provide this to you guys. Big thank you to Jessica, Brett, Kemi. I know it's been, you know, just so much going on, and they are such a valuable resource in the community. They do great work at Working Partner. So we're glad to have them as our partner at United Way of Greater Houston. So just thank you.
Thank you.
Thank you.
So
Thank
we
you.
hope, you're welcome. Thanks, guys. So we're hoping that we'll be able to bring you Coffee and Quality in May. We're scheduled to have that on Thursday, May 21st from 9 to 10:30. It will most likely be a virtual setting, so we're still excited to have that. And that session is going to be focused on CQI culture and teams. We have 4 agencies that are already lined up and have agreed to do it virtually if we're in that space, which I imagine we will be, to do Coffee and Quality focused on your CQI culture and your CQI team. And I can't think of any time than to really leverage that team to make sure that you're, you know, having this discussion at your agencies. So if you viewed that, so hope you can, you know, stay tuned for that, more information on that to come. And then if you viewed this whole webinar all the way through, thank you. And please, your feedback is a gift. I want to hear it. So you can, you know, enter the survey link, do the QR code. We really thank you so much for your time. And thank you to Kemi, Brett, and Jessica. So
Thanks,
bye.
Jessica.
You're welcome.
Have a great day.
Thanks.
You
Bye.
too.
Bye, everybody.
Bye.